I was told this week that the nation is looking at Arkansas because I have on my desk another bill passed by the General Assembly that is a product of the cultural war in America. I don't shy away from the battle when it is necessary and defensible, but the most recent action of the General Assembly, while well-intended, is off course, and I must veto House Bill 1570. I have signed the veto of House Bill 1570 today. I have notified the sponsors as well as the leadership in the House and Senate as well. But I wanted today to explain a little bit of the reasoning. If House Bill 1570 becomes law, then we are creating new standards of legislative interference with physicians and parents as they deal with some of the most complex and sensitive matters involving young people. House Bill 1570 would put the state as the definitive oracle of medical care, overriding parents, patients, and healthcare experts. While in some instances the state must act to protect life, the state should not presume to jump into the middle of every medical, human, and ethical issue. This would be and is a vast government overreach. If House Bill 1570 simply prohibited gender reassignment surgeries, then I would sign the bill. But the bill is overbroad, extreme, and does not grandfather those young people who are currently under hormone treatment. In other words, the young people who are currently under a doctor's care will be without treatment when this law goes into effect. Finally, I understand that the General Assembly will likely override this veto. House Bill 1570 had overwhelming support when it passed the first time, and as you know, it takes a simple majority to override the governor's veto in Arkansas. I am hopeful, though, that my action will cause conservative Republican legislators to think through the issue again and hopefully come up with a more restrained approach that allows a thoughtful study of the science and ethics surrounding the issue before acting. Government, under a conservative philosophy, should be restrained. This is an example of where restraint is better than overbroad actions that interfere with important relationships in our society.